Judy, why is she wearing black and white? Is that just, she's a pirate today?
Week of rodeo.
Oh, that's a rodeo scarf? Oh, I guess it is a rodeo scarf. Hee-haw! All right, Billy, let's do it. Happy Friday, Baylor College of Medicine and Friends of Baylor. Well, it was bound to happen after 4.5 years of doing videos. I may have made a misleading statement. So last week, I was one of our faculty members, but also a friend of mine who's the former director of the FDA, Rob Califf, mentioned to me that I had suggested that maybe it wasn't always right to tell people what to do, and individual freedom was an important thing. Well, when it comes to mandates, there may be reasons for them, and so I'd like to at least explain my view from last week. So what was frustrating to me and to many of my colleagues is if you look at during those COVID years when the vaccine was available, starting here where this blue line is, there was a huge number of hospitalizations and a huge number of deaths. And some people thought, well, is it really related to the is it really preventable by the vaccine? So this data was really, really compelling, and this is what bothered me the most. This peak of mortality here, these two peaks, was when Omicron came, this in between Delta and Omicron, when the vaccine became available. And if you look at the peak of mortality during Omicron, this is unvaccinated people and people who are vaccinated. So there was a huge difference. And this represents 600,000 people who passed away because they didn't get vaccinated. And so my point was, that's frustrating to individuals in the healthcare world, because whatever we did not convince people to get vaccinated. And it could have been because we were telling people what to do rather than educating them. It could have been because we were mandating things. But my point was that not that mandates don't work, because they were very important sometimes, and I'll give you some good examples. So hospitals should always have the right to demand that their staff be vaccinated and mandate masks if they need to, and there's plenty of data during the COVID pandemic. Remember, the very first physician from Wuhan who reported this unusual respiratory illness died from it, got it from his patient. And then there was a bunch of data that came out in the United Kingdom where a patient who is uninfected had an 8-fold increased chance of getting it per 1,000 patients if they were on a ward with another patient who was infected. And in Wales, there was an outbreak of 56 staff and that spread to 29 cases in the community. There were a bunch of reviews that were published early on showing that where masks and respirators were used, they reduced hospital infections. And then in Singapore, where hospitals adopted mandatory masking policies, they dropped infection rates in the hospital. And so it was perfectly appropriate for a hospital to mandate vaccines and mask policy. And I was not saying that was inappropriate. I actually believe that. In fact, the Texas Medical Center, shortly after all this data was available, we all adopted a mask policy, which I think was very, very important. Similarly, airlines should have the opportunity, if they need to invoke masking when necessary. If you recall, I went through the data. There were many international flights where people were infected by other folks in the airplane. Once universal masking was mandated, there were no infections, absolutely no infection that were documented from airplane travel, which is kind of amazing. It also showed the ventilation and HEPA filtration in airplanes is pretty good. The other time is like you look at schools. So there was a lot of controversy around that, but where school systems mandated masking in kids versus non-mandates, there was a much lower infection rate. That was shown in Boston schools, it was shown in North Carolina schools, and it was also protective for teachers. It turns out, in retrospect, we probably shouldn't have required children have masks on when they're outdoors, because outdoors is enough ventilation. So, that was a mistake we made, but at the time, and schools should have the authority to require masking when appropriate. Now, when you get to other huge outbreaks, it was remember, weddings, funerals, family get-togethers. And it seems like the most appropriate there is the family decides. I used to say, if Uncle Bob refuses to get vaccinated or wear a mask, don't invite him. And I think that's what families should do. But at the end of the day, if an individual is living alone and is not affecting anybody else, and they don't want to get vaccinated or wear a mask, as long as they don't impact other people, who are we to say that they shouldn't? That was my only point. A little clumsily made, maybe a little controversial for some, but I didn't mean to suggest that mandates for masking and vaccines weren't important, because they are in certain settings. Well, let's move on from that. Let's talk about measles, huge outbreak, mostly because people aren't vaccinating enough. We're up to 279 cases in Texas. Remember, I've said before that the vaccine is 97% effective, at least historically. Well, of the 279 cases, only 2 were vaccinated. And so it's even, according to our own data from Texas, 99% effective. So if people have been vaccinated, it wouldn't be a problem. But it's there's outbreaks breaking out. There are outbreaks everywhere. Houston has had 3 cases. Vermont had their first case in a school-age child from international travel. This is what usually happens. Because the United States was very good at vaccination, we eliminated it. Remember, I showed the graph. We eliminated it in the year 2000 from the United States, but it still was worldwide. And so if you're unvaccinated, you have a risk of getting it when you travel, or if someone from outside the country comes in. And if communities are not at least 95% vaccinated, then there'll be outbreaks. There were 2 cases in New York City, and if you look at across the board, and I knew we were going to exceed last year. We're up to 301 cases. Last year was 285, and then we still haven't reached what was in 2019, but we're moving on towards that. Now, Europe is equally having problems because the reduction in vaccines in general is a worldwide phenomenon. So in Europe, in 2016, when people were pretty good at vaccinations, there were 4,400 cases. But in this year, European countries have reported 127,000 cases. 40% of them under the age of 5. And more than half of those have required hospitalizations, and there have been 38 deaths in children, all of them preventable. Romania in Europe has the lowest vaccine rate, less than 80%, and you wouldn't be surprised. They have the highest number of cases, 30,692 cases in Romania. The second one is Kazakhstan. They have 28,000 cases, they're number 2. But according to our sources, Borat believes they will be number 1 in Europe because, according to Borat, who needs vaccines anyway?
It's very nice.
Kazakhstan, I think, is suing Borat. Sacha Baron Cohen. Anyway, I like Borat being the spokesperson for not getting vaccinated. All right. So anyway, as respiratory diseases go, we're seeing the waning of the flu season, but there's still a lot of flu around. It's decreasing, but there's a lot around. COVID is around, but not too many cases, still reducing. And they came out this year, the FDA came out with their recommendations for next year's flu vaccine. So it's the same vaccine structure. There hasn't been a lot of mutations this year, so it's H1N1, H3N2, just like this year, and influenza B, Victoria lineage. So we think there'll be enough supply for next year. And I like to look at TEFI because that's the best example of how we can screen all the viruses around. This is the wastewater analysis, and it's very interesting. Influenza A and B still high, but coming down. Parvovirus 19 is around. That's the slap cheek disease in kids. Respiratory syncytial virus A and B are still high, but coming down. Rotavirus is increased recently, and SARS is sort of flat. So one interesting study I found was on the impact of H5N1 bird flu on dairy cows. We've been talking about how it's been a big hit on the milk production, so scientists studied one particular dairy herd in Ohio that had 3,900 cows, and what they showed was there was a dramatic reduction in milk production. But they also, what was interesting, was that there are a bunch of asymptomatic cows who were infected. So they did a seroprevalence study of this herd, and this is really remarkable to me. 89.4% of the herd was infected, and they were the symptomatic ones. But there were 76% seropositive in animals that were not clinically, impacted. So they looked normal, but there were still 76% of them were seropositive. So they had exposed to and had the H5N1, but managed it okay. We still don't know the exact mechanism of transmission in the cattle, but it is pretty clear that it spreads widely in the cattle herds. Anyway, so there's the economic impact on cattle and the poultry industry has been really, really dramatic. Anyway, I want to end today with a bunch of shout outs. First of all, today is match day. Match day is one of the most important days in a doctor's training career. You finish your medical student, as a medical student, you graduate, and then you have to match to see where you're going to do your specialty training. So this is the day when everybody finds out. It's managed nationally, and so no one really is sure where they're going to be. So it's a pretty exciting day. And so we're very excited for our students who are going to become residents. Also, I want to congratulate Dr. Joseph Mills, professor of surgery, who received the Roger Pecoraro Award from the American Diabetes Association. This is awards a particular scientific achievements in the prevention, treatment, and management of diabetes-related foot complications. Also, congratulations to Susan Hilsenbeck, professor in the Smith Breast Center and Daniel Duncan Comprehensive Cancer Center, who is one of 33 cancer researchers elected to the 25 class of fellows of American Association for Cancer Research, and that's a really honorific designation for people who have been very innovative in the field. And finally, of course, this week marks the end of the Houston Rodeo. Lily has her last, she just woke up. Lily has her last bandana on from the rodeo. And I want to thank everybody who stopped by. We have a booth this year so you can take a picture with our chuck wagon. And of course, we were very excited to Post Malone, who came by to get a special picture with our chuck wagon before he performed on Tuesday. Anyway, have a wonderful weekend, and I can't wait to see you next week.